Hello everyone, and thanks for tuning in. Today I'm going to be talking about frailty. This video is aimed at both the public but also healthcare professionals, and particularly doctors, who are the ones who are often making important decisions for how we manage frail people. This video might be upsetting for some, as I will be talking about aspects related to life, death, indignity and suffering, which are all important aspects when it comes to talking about frailty. So what is frailty? I want you to imagine in your head what a frail person would look like. You've probably imagined an elderly person, maybe quite skinny, a bit unstable, holding a stick, and they look like they might break something if they fall over. And that is almost what frailty is. You don't have to be elderly to be frail, but being old is the biggest risk factor, and as you get older, you become more likely to become frail. Frailty is a complex syndrome, and it's underpinned by the aging process, but also someone's overall physical health and their functional ability, what they're able to do for themselves. Frailty is essentially not being able to bounce back and recover from illnesses. Instead, you become weaker, less able to look after yourself, and your health gets slightly worse. And this inadvertently results in you becoming more unwell and more unable to look after yourself as frailty progresses. The typical pattern in frailty is that you become increasingly frail, and therefore you have increasing hospital admissions as time goes on. They can be due to confusion, falling over, having an infection. Often frail elderly people come in with very non-specific symptoms of being just generally unwell, maybe being confused, not eating and drinking, not being right, and it's up to the doctor to work out what's going on, and that can be difficult. As time goes on and they keep getting admitted to hospital, they become weaker, more unwell, unable to look after themselves until they eventually die. Often in the last year of life, a frail person will be admitted to hospital many times, often, within days or a few weeks. And this is the time when it's important to identify that someone is likely in the last stage of their life. It's important when we're talking about frailty to understand the concept that your physical health will often have a very strong relationship with your functional ability. Functional ability is someone's ability to look after themselves and to be able to walk. So, someone who is quite slow, maybe uses a walking stick, and they struggle to get their clothes on in the morning and, do their shopping, but they manage. They're mildly frail. Maybe they're just vulnerable. But a very frail person is someone who is unable to get out of bed without assistance. They can only sit in a chair maybe. They may have incontinence. Functional ability is everything from getting out of bed in the morning to putting your clothes on, brushing your teeth, making your breakfast, having a shower, taking your pills, remembering to turn the heating on, going upstairs, going to bed. It's everything. And if you're unable to do this for yourself, you'll need care. You're going to be more vulnerable to becoming unwell, and this will make you more vulnerable to coming into hospital. When you come into hospital, you have a lot of bed rest, where you might be confused and not eating or drinking, or because you're confused, you're distressed about where you are. This makes you weaker over time, and you lose your muscle mass, and this makes you less able to walk and less able to look after yourself. And this is why you're more likely to fall over or become unwell. This is the frailty process. So here's an example of a tool that we use to assess someone's frailty. As you can see, it looks a lot at someone's ability to look after themselves and their mobility, but it also looks at your health. To understand why age isn't the only factor to becoming frail, but an important one, we have to understand the concept of organ reserve. An organ is required to keep you alive, and we have many organs that are required to all work for us to stay alive. It could be your heart to pump blood around your body. It could be your blood to deliver oxygen and nutrients to the cells that keep you alive. Your brain is required to regulate the function of everything and your thoughts and your actions. Every organ adds up to your overall physical health. Naturally, as part of the aging process, your organs get used up over time, and they have a smaller ability as time goes on to do the job that they need to do. Therefore, if you live your whole life with good health and all of your organs slowly deteriorate at the same rate, you are likely to become frail because your overall physical health is very low, and therefore your physical ability to look after yourself is also going to deteriorate over time. This is why you don't have to be old to be frail. It only takes one organ to fail, or to be in poorer health for you to start to lose your physical ability to do things. You could be a young, fit 20, 30-something-year-old person and have severe kidney failure. You will feel ill all the time, have a poor appetite, have a lot of illnesses related to having renal failure, and then you'll need to wait for a transplant to have a chance of going back to having a normal life. But even with a transplant, it will only last so many years, and you have to take quite nasty drugs just to stop it being rejected from your body. People who smoke, for example, the health of many of their organs will deteriorate over time, and that's why they die younger. Or, for example, having a heart attack at a young age will mean that your heart doesn't function as well, and it starts to fail over time, making you frailer. It doesn't matter that all of your other organs have an extra, say, 30, 40 years of life left in them. If your heart only has 10 to 20 years of life in it because of the damage that has happened to it, unless you get a heart transplant, you're going to die that 10, 20 years younger. And so therefore you'll become frailer at a younger age. A very good example of extremely frail people who are young are alcoholics. You could have a 40 or a 50-year-old who has drank heavily all of their life, coming in with liver failure. They are some of the frailest patients who struggle to stay out of hospital, and they die very quickly from a diagnosis of liver failure. So your organ reserve is the most important factor to your lifespan. It's also the most important factor to living well, having a good quality of life. Because if you have a single organ or many organs with a low amount of reserve, i.e. a smaller ability to do what they're meant to do, you're just going to be more prone to becoming unwell from disease because your organs need to function well for you to stay alive. If you have a disease that's interfering with an organ in your health, the organs are going to struggle to keep up. If you've had a heart attack and you have heart failure, you've had a stroke and you have, memory problems, or if you have COPD from a lifetime of smoking, a transplant isn't going to save you. Unless you become unwell very young, if there are only a finite amount of organs to give to people, it will go to the youngest and fittest people who have the best chance of surviving with those organs and making them worthwhile. I know this subject is a big downer, but I want us to actually look at it slightly differently. To become frail from being elderly is actually a blessing. It's actually a success. And I think that societies who have people dying predominantly of frailty are societies that have done it right. The reason people are becoming frail is because we have succeeded so well in keeping people alive and healthy for such a long time. If someone stays well enough with no organ failure, we will start to see frailty, the result of someone living a long, healthy life, using up all of their money's worth, all of their organ reserve on good quality of life and living. They get to the point where they are elderly, and because they are becoming more frail and weak, it shows us that all of their organs are, equally poor in function. Not one single one of them is causing problems. The mileage on their organs is coming towards an end. Frail elderly people have achieved something that we all want, and that's to be able to live a long, healthy life and not die prematurely. There is one thing that medicine will never cure, and that's frailty. Because to cure frailty is to cure the aging process. And to cure the aging process, it's like curing cancer. It can't be done necessarily. Mankind will never find immortality through the human body. They would have to upload their consciousness onto a computer system because aging and cancer, unfortunately, the natural processes that happen with the body that we have. Frailty is unpleasant and undignified, so it's important to see the silver lining and appreciate that it's a natural process and a marker of someone, reaching older age, living a relatively healthy life. Dying with frailty can be made to be more dignified if society and the healthcare professional can learn to accept that sometimes the kinder thing to do is to not over-treat people, not play God and keep people alive when they have little quality of life or don't know what's going on around them. In the last months to a year of life in frailty, you're in and out of hospital suffering many illnesses as your physical ability gets worse and worse and worse until you become completely bedbound and dependent on people. Often people have dementia or they're just delirious and confused from being so unwell. This is a very undignified time, and often these patients aren't really able to tell us what they really want, and we have to make best interest decision for them. Many of the hospital admissions towards the end of a frail person's life are avoidable and inappropriate. We have to understand that people do not do well getting admitted to hospital. They often come out worse. Just changing the environment and putting them in a place where they're not trying to, look after themselves and use their ability, it makes them weaker. They don't eat, their muscles shrink, and they become more frail and unwell. We need to learn to manage these patients in the community and stop them coming into hospital. Often these admissions don't really succeed anything, and it's just undignified. They're in a hospital bay with other patients who are calling out in distress from their dementia or their delirium. They'll soil themselves and have to wait to be changed. They won't be eating nice food. They will be isolated from their family, especially during COVID where you can't have visitors. They have decisions made for them. They have blood tests, and often they can't tell us what they want because they're too confused. Often they don't tell us what they want because they're too scared to, and they're used to doing what the doctor wants. Often they don't tell us because we don't think to ask. If you ask a lot of people, would they want to be kept alive if they had a big stroke and were completely dependent and had a poor quality of life and were confused all the time? A lot of people would say no, but we make the decision to keep these people alive every day. Of course, I think it's right to keep these people alive, but not when, they don't know what's going on or they need to be fed and whatnot. You have to understand that we're trying to keep the people alive, not the body. This doesn't mean I'm making rash decisions and deciding who lives and dies based on what I think looks dignified and what I think is right, and I define when I think it's right for someone to die. No. I'll always go and ask someone, what do they want? Do they want to be in hospital? Are they happy for us to treat them? What do they want? Some of them will tell us that, they're happy to be treated and go on and whatnot, and that's fine. Of course, I'll treat them. But when I think someone isn't going to benefit from my treatment, or actually we are fighting a losing battle and they're not going to see any improvement in their quality of life, which is what we all want really, I will tell them the truth and I'll explain this to the family. And sometimes it's better for someone to be made comfortable and to not be admitted to hospital for an undignified hospital admission. At least once or twice a year, I'll have a frail elderly patient, often one to a, socially isolated, really suffering. I'll have someone say to me, "I just want to die, doctor, let me go." I find that really difficult. It was the reason why I decided I didn't want to do geriatrics for quite a while, and I actually preferred the idea of palliative medicine where I'm treating patients dying with cancer, often younger. But, there's a great amount of pride you can get from looking after these vulnerable, frail people who don't often have people to advocate for them and do what's right. Family members, they mean so well and they love their loved ones, and sometimes they need to understand that the kindest thing to do is to not put them through what we're doing. The problem is with people's expectations and understandings of, people being frail and getting worse with every hospital admission, for us to not always be able to make them better. If we can all understand and appreciate this concept, people can have a better, more dignified, more enjoyable last stage of their life. Most frail elderly patients are often confused. This could be due to dementia or delirium. Delirium is just when you become confused from being unwell. Delirium is often a precursor to dementia, and people often die before a dementia diagnosis is made. Sometimes these patients will refuse food, observations, treatments, blood tests, and as you become more experienced, you learn to know which ones are trying to tell you to leave you. They're trying to tell you that they don't want to keep going through this. They're tired of the indignity. They want to be left in peace. They want to pass away naturally. And this is the crux of the matter. Knowing when it's right to go on actively treating someone who is so frail. Knowing when their time is up. It's all about knowing at which point modern medicine is doing more harm than good. Knowing which point you are taking it a step too far and actually this is the end of someone's life and this isn't something you should be treating. We have to understand dying is a natural part of life. It's important as a doctor to learn when someone is so frail that the illness you are trying to treat should really be the one that they die naturally of. Is that a natural way to die? To keep treating the infection until they die instead of malnourishment? Now, don't get the wrong idea. I would treat aggressively any 80-year-old who is fit, well and independent, any 80-year-old who is, struggling to get around with a frame, but they're living life, of course I'll treat them. I'll give them everything. I'm not going to go and do CPR on them, but I'm going to give them every chance they deserve to go on living the quality of life they had. As a geriatrician, as a frailty doctor, I'm not just trying to, give people a comfortable death and, know when to stop treating them. I'm trying to give them quality of life. That's actually what geriatric medicine is. It's trying to preserve people's quality of life and maintain their independence. It's about knowing what's right for the patient. Understanding that being frail and elderly means that we have to treat you in a different way, and understand that coming into hospital isn't always best for you, and sometimes, knowing when to draw the line on treatment and know when it's just someone's time and you can't achieve anything more to help them. And as a doctor, as a nurse, don't be afraid to, explain to a family member what the real expectation should be, what the reality is of being frail is, and that when they get admitted, don't expect them to come out better despite us potentially fixing the illness. Our NHS is not built for this ageing population. It's getting better over time as we open up more and more frailty services and focus on caring for frail patients in the community. I'm proud to say I work at Whipps Cross Hospital, which has a fantastic frailty unit, and we also have a service whereby a patient can be visited at home by a doctor and a nurse, and we can often assess them and see if they really need to come into hospital. We must remember, when we're trying to beat this disease, we're trying to keep them alive, that there's someone's quality of life and life experience in between all of this, and you just have to have a think about, what does that patient really want? Have I asked them, have I considered whether or not this treatment will really give them, a quality of life afterwards? And remember, frail patients are vulnerable and often unable to make decisions for themselves, and we need to do what's right for them. We also need to be strong and be confident when we're explaining to relatives that we are acting in their best interest sometimes when we're doing less. Less is more in frailty medicine often. So I hope you enjoyed this video. I know it's quite a serious topic, but it's one that I'm really passionate about as a geriatric doctor. I think frail people are a very vulnerable part of society, and we need doctors and healthcare professionals to advocate for them and to do what's right for them. We also need to keep them well and healthy and out of hospital, and keep them enjoying living at home in their own place as long as possible. Please like, subscribe, comment, all of that stuff. I really want this channel to become something. I love to teach, and I'm really passionate about geriatric medicine and medicine in general, and I really want to push subjects I think are poorly understood by doctors and the general population. Thanks for tuning in. Until next time.